The one thing that we've seen the most drastically in the years in regards to professional athletes and directly related to performance is sleep. That's one of the biggest things that you can do to enhance clarity, performance, overall, delivery, muscle tone, hormone balance. When you see individuals that are performing at their absolute highest level, they are on a regimen and sleep schedule.
Hey guys, welcome back to another Rest, Eat, Move podcast. It's Matt, and I have our special guest Jill back in for part 2, talking about physical therapy. And when we left, which would have been episode 301, I told Jill I wanted to come back for part 2. And instead of waiting, we might as well do it right when it's hot and when we're thinking about it. So this is part 2 of our conversation. And usually when we do a part 2, it was on the same day, the conversation. But this is a separate day. But we're going to build off her last statement of podcast 301, which was always challenge your healthcare system and professional to give you the best care to optimize your health, not just your insurance benefits. I thought that was, it's something that I struggle with and try to teach people to think about, but it's not easy. And so we'll build off that today. But Jill, thanks for coming for part 2. My first question, I asked it in the first podcast, is why should somebody who isn't injured think about physical therapy? Let's start right there and build off. It's for everybody, but
yeah.
Why should someone think about physical therapy who's not injured?
Well, yeah, and thanks so much for having me back. And it's always great to sit down and really talk about how do we move our communities forward in regards to health and wellness. And the more we can talk about it and the more transparent we can be about it, the more people are informed and
right.
the better decisions they can make. And so when we look at what, really makes up physical therapy is we're seeing in medicine more and more specialties and specialty utilization. So, somebody's going in for neurology or nephrology or, all of the different orthopedics and all of the different specialties. But what we're seeing is that there's oftentimes a miss of that holistic look at healthcare. And so that's where that niche of musculoskeletal movement in regards to physical therapy, occupational therapy then takes it into that functional level there. But it's one of the few professions that are actually trained to look at the musculoskeletal system. And it's one of the top 3 healthcare spends because we're not paying enough attention to it. And so I always say, we've talked about the importance of developing your healthcare team before you need them. And I can tell you that physical therapy, occupational therapy, that rehab subset is a team member that you need to have on your team. They know the outcomes, they know the rehab, they know preventative, they know how your musculoskeletal system moves.
So top 3 musculoskeletal injuries or top 3 healthcare spend, or when you say that, what's that?
Yeah, musculoskeletal injuries are in the top 3 of all healthcare spend.
And some of those aren't like what people think always an accident. It could be chronic.
Right, chronic low back pain, neck pain, injuries, surgeries, ACL surgeries, total joint replacements, like any kind of musculoskeletal sprains, strains that are all prevented. Top
3.
Yep, they're in the top 3 of all healthcare spends, right up there with cardiovascular.
Do you have any percentages of the general population that uses physical therapy? Like, what are the stats on that?
So when we're looking at nationally right now, they're talking about in regards to the individuals that actually need physical therapy, that could benefit from physical therapy, are anywhere between 58 and 65% of individuals are not receiving the care that they need.
So 60+% need it.
Yeah.
How many people are doing
so
it?
Of those, so that's what I'm saying, of the people that need it, over 60% of them are not receiving it. So over half of the people that actually need it and are qualified, that should be coming in, and the majority of those would be covered by insurance, don't get referred to physical therapy because the healthcare system doesn't understand how to get to physical therapy.
All right, so the what we talked about before we hit record, is the solution for the consumer to ask for it, or is it not that simple?
Yeah, the consumer can ask and say, hey, I would like a musculoskeletal evaluation. Like you go in to have an internal medicine evaluation for your physical.
Right.
They're looking for, your blood work. Do you have diabetes? Do you have,
maybe,
general.
right? But they should be, yeah.
Right, yeah. So they're looking at like internal medicine. But think about your last physical. Did you have a full musculoskeletal evaluation? Like, did somebody assess how your lumbar paraspinals move, how the joints move, your risk for impingement, your risk for ACL tear for an athlete? I can tell you an athlete that has a considerable risk for an ACL tear before they do it and prevent it.
So my brain goes a couple of different directions. I have to say this, I've said it before, but my last physical, and I'm due for, number one, I have to find a good primary care physician that I like and I have a relationship and I believe in their philosophy. But I went to get a physical because it was a while since I've had a physical, and I went into this facility and I didn't have a relationship or anything, which that's part of the challenge is how do you build a relationship that you don't have?
Right.
Or if you don't have a referral, where do you go? And my physical consisted of blood pressure, heart rate, the typical things that my wearable probably could tell me if I was wearing one. Mm-hmm. Never took off my shirt, never took off my shoes. I could have had lesions on my back and scoliosis and all the things and did none of what you're talking about. So I can feel you that it's not happening unless people are kind of driving the bus themselves. But that's
and advocating.
And
right?
advocating.
I mean, you have to be an advocate for yourself because those are the things then. So at the end of your physical, some of those questions should have been, what were the findings? Yeah. And from what you found, what do I need to do? And if part of that becomes a medication that's being prescribed, the question always needs to be, what do I need to do to get off of it? Or what is the discharge plan of this medication?
Yeah.
Right? So it's not that we don't ever have to take any medication. Some of them are necessary, absolutely, for certain things, but there should be a discharge plan for what it is. And what we see oftentimes is when somebody comes in, I've seen an individual that came into me and she was completely, like she could hardly walk, she could hardly function, she was bedridden, and she was somebody that was very active prior to that. And digging in, and I think we talked about this earlier, I had found an individual in Australia that was a tremendous GI and nutritionist and sent this person to that individual. What they found out is that the medication that she was taking, that she started taking for pain, had completely obliterated her gut biome. And so because of that, she had an inflammatory response in her body that was so tremendous, her joints were inflamed and extremely painful. So they went through this whole prebiotic, probiotic cleanse of her gut that they did, and it took 5 to 6 weeks. And this person was like changed.
New person.
And yeah, biking, walking,
had to go
moving.
To Australia to get
but that was a side effect, I don't say that medicine has side effects, they're all effects. Mm-hmm. So you need to know what are the effects of the medicine. Some of them are good, some of them are bad. Mm-hmm. But you need to understand that if you stay on anything so long, that's a chemical that's not natural that you're putting in your body, there's going to be an effect. And how do you
need the
mitigate
discharge
that?
plan. Yeah, I mean, you think about that in your world because that's what you do with many of your patients. But I think, yeah, it's really interesting. And one of the things that also stood out is you're saying you can look at somebody and you can kind of determine if they're high risk, low risk for musculoskeletal injuries. And so you think about like the typical sports physical. Mm-hmm. What do you think about a typical sports physical where they're just checking your eyesight and have you had a concussion or not, weight? And
yeah.
Couldn't it be so much more powerful?
Yeah, I think we should do jump testing. And we do this. Like when I worked a lot with the professional teams, you do that.
Yeah.
You do VO2 max testing. You do jump testing. You do power testing. And
because you have an
sometimes
investable interest in them.
Yeah, I mean, because these are $1 million bodies. But to me, my kids' bodies are worth more than $1 million to me.
Yeah.
You know, like I really want to know if they're healthy. And I'll tell you.
But it doesn't sound like it's crazy amount of testing either. No. Like, I mean, some of these things you can pick up on. You can pick up with jump testing, power testing, range of motion testing, strength testing. And when I go in, I can tell you, when I go in and you would think as strong as the football teams, our high school football teams around, like these are some of the strongest kids in school, right? Yeah.
They're lifting on a regular basis. They're in the weight room. They've seen a barbell or two, you know, if they're on the football team. I could tell you probably around 30 to 40% of them still can't do a push-up correctly. And that's because their core is weak. But yet they're bench pressing and squatting hundreds of pounds
Without the stability.
without the stabilization, without the flexibility, and without the core stability and foundation. And those things you need to know, because you can prevent a ton of injuries just by increasing core power so that you have more resilience in the lower extremities.
So, I
of the
mean,
upper
this
extremity.
cannot, again, I think the takeaway is it's not just about prevention and it's not just about injury prevention, but it's also about performance.
For sure.
Because everyone gets so fascinated about, like, what's the performance strategy? The physical therapy can be part of the performance strategy.
Yeah, for sure. Like, injury prevention is really optimal performance. It's not just that we're trying to prevent injuries. It's that if your body is ready to perform at the highest level, your chances of injuries are way less, significantly less.
Injury prevention equals performance. Yeah, I mean, I agree so much. And I think that's why we're doing part 2 is so many more people could benefit. And it's not about a 12-week stint. It could be literally a checkup, kind of a testing.
Yeah.
But the expertise, you've seen it all. You've seen from one spectrum to the next, and then kind of helping people take that avenue. Now, physical therapy, just like anything, if someone comes to see us, we can't do the work for them outside of the session. You know, in physical therapy, one of the things I love about it is the manual manipulation, and you're kind of moving my body in some spaces where I don't have to necessarily do the exercise.
Yeah.
So there's somewhat of a therapeutic thing there.
For sure.
And I think we fall in love with that maybe a little bit too much on both ends. It's like, well, I went to my physical therapy appointment, but the physical therapy appointment also gave you homework that we didn't do.
Right, yeah.
So I think you get as much as you put into anything.
Yeah, I mean, I think you need to work. It's not if you think about it, say you go to physical therapy 2 times a week for an hour, that's 2 hours of your week. What are you doing the rest of the week? And, you know, your muscles have a what's called creep. They want to go back to where they were. They want to do the things. And so, you know, and I take that a large responsibility on the providers and the practitioners that I train, because if I've audited many clinics across the state of Michigan when I sat on the state board. And, you know, what I've seen is oftentimes it's been something where it's like they just give a list of exercises, or after surgeries, you have 3 pages of things that they're supposed to do.
Yeah.
That's not going to do it for people. Like, that's not, like, that might be, you know, for the first week after surgery as a guidance. But if you're really looking at individual performance, I give people 1 to 2 things to work on, and I tell them why, and I show them what improvement looks like and what it should be when they come back to see me next. And so they work on it because they're like, man, she's going to know if I don't have these muscles.
So when they come back, it's like
because I can feel that, right? So if it's like I'm trying to get their back muscles to activate, it's a simple exercise. I want you to do this, and I want you to be able to turn it on and turn it off by doing this. And when you come back, we're going to test it, because that's the building blocks of what we do next. And we don't get to go on with these exercises until you have the foundation of what you need to train on.
I mean, I think our philosophy is so similar. It's like what's happening in the peptide space is it's like the solar panels. They're cool and they're fun, and there might be a thing that can help if that's what you're looking for, but we haven't even built the basement yet.
Right.
And it's the same thing with movement. You know, you want to do the bench press because you want to, you know, lift the most because that must mean peak performance, but yet you can't engage your basic foundational core muscles.
Yeah, so we have people that can push a lot of weight incorrectly.
Which creates injury, which then doesn't equal peak performance. And that's the name of your company. So it's a perfect segue.
Yeah.
All right. So what's your biggest movement? Like, what's the biggest movement mistakes that you see people making every day? We talked about the neck a lot.
Yeah.
What movements are people making that are really not setting them up for success?
Well, you know, I think it's overall posture, and they talk about, you know, sitting as the new pandemic.
Smoking.
And smoking and sitting, right?
Yeah.
The 2 S's, and so when we look at that as far as sitting as the pandemic, and especially as we're getting into the technology era, you know, I mean, we're we're full blown into it. People are sitting, they're on their phones, they're forward, a lot of forward movement, forward momentum, sitting flexed in that position. And we know, and there's a lot of information out there, even from Aaliyah Crum out of Stanford and Harvard, that talks about how posture actually even affects your hormones. And so there's power posing. I don't know if you've ever heard of that, or power posing, where you're in a position and your hands are on your hips in a position like that. So being in a position, and if you look across many generations and many, it doesn't matter, ethnicity, cultural, whatever, when somebody is in a power pose, they're usually open, their hands are up. Like when somebody wins the gold medal, right? They're running with with their hands over their head. What that does is that pose alone causes a spike in testosterone in both males and females.
I didn't know that.
And it changes your cortisol level. So it's going to decrease cortisol, increase testosterone, increasing confidence, and decreasing inflammation and overall stress and inflammation. So
sitting's not just about the posture. It could be hormonal. It could be...
Right. It's affecting overall, right? It can be affecting overall health and wellness and well-being because it's changing you chemically as well as it's changing your musculoskeletal, your posture.
How about building off that? If we're forward so much, is there any exercises, when you're probably like us, where when we go to the gym, sometimes you don't even want to look.
Yeah.
Because they're not asking, right?
Yeah.
But is there any exercises that you're seeing done that, or maybe even adding to this forward sitting position that people really should think twice about? And I know you're an advocate for moving your body and exercise, and so movement's a good thing. But,
any kind of movement.
But is there any exercise that you just really are not a huge fan of?
One of the biggest things, and I'll tell you one of the biggest things that I correct on almost every patient that they come in to see me with, is how to stretch their hamstring. 90% of people that come in that think they're stretching their hamstring they are actually stretching their sciatic nerve. And so if you look at it from an anatomical, and I've been through many aerobics classes and taught some of them, and step classes and punch class, whatever. When you warm up and you cool down at the end, they will always say, and if you really want to feel a better hamstring stretch, bring your toes up towards your nose. They'll put you in the position and just draw your toes up to your nose and really pull that up, and you're going to feel a nice stretch behind your thigh into your hamstring. Well, your hamstring doesn't attach anywhere in your ankle. And so by moving your ankle, you should not feel more of a muscle belly stretch of your hamstring. And if you do, you're stretching a sciatic nerve, and we don't stretch nerves, we glide nerves. And so oftentimes what I see is people will come in with what they think is tight hamstrings, and they're stretching it by dorsiflexing or putting their toes closer to their nose, thinking they're stretching a hamstring.
Because it feels like something's happening.
Yeah, and it feels like a stretch. A nerve stretch is going to be an intense stretch, but it's going to be the whole length of your leg. It's not going to be behind your thigh. And so as they're stretching their hamstring, that they think they're stretching a nerve, which causes their hamstring to feel tighter, which causes them to stretch their hamstrings more, and then you see the circle.
Inflaming the nerve.
Right.
No, that's beautiful. Yeah, that's such, again, because you're in the space all day, every day, and that's, again, it goes back to the first question of who needs this. Just thinking about this, coaches, parents, trainers, personal trainers. It's just it's a whole different mindset that I think both of us feel sit either on top of or below to help expand whatever discipline or specialty that there is. And I think the specialties can be very beneficial. There's a reason why there's specialty medicine.
Yeah. And brilliant people in them.
Brilliant.
Yeah.
Much smarter than me. But I think the opportunity with the mind and the body is the holistic view.
Yeah.
Connecting all those things, because at the end of the day, just like it's hard to get anyone to change any behavior and habits are really the root cause for us to take control.
Yeah.
And if it's too difficult or it's too expansive or it's too specific, if I'm just going to be working on a certain part of my body, I'm neglecting the rest of my body.
Yeah.
And people have a capacity of what they're willing to do or change in that moment.
Yeah.
But stretching the hamstring, which is the sciatic, that was another question is, you hear a lot of people that stretch so much and they still feel tight. Is there anything you'd expand on what you just said, or is that really what's happening when people are just stretching and stretching and stretching and still feel tight?
Yeah, and I think that's a really interesting dynamic that I see, because oftentimes, and I've had a subset of my career that I treated, they're EDS, so Ehlers-Danlos patients, which are patients that are extremely unstable. So their connective tissue is not formed the same way that our connective tissue is, and they're very lax. And so they will sublux a shoulder, or they'll sublux a hip, or they'll dislocate their kneecap.
But they look flexible.
They're very flexible people. But what they come in and tell you is that they are so tight. So they subjectively will tell you that they're tight. And they will come in oftentimes with prescriptions, physical therapy, for stretching and manipulation because they're so tight, because that's how they feel. So what happens is that individuals that have increased flexibility, or we call it hypermobility, too much mobility, their muscles are working overtime to keep their joints stable. And so what happens is their muscles, like if you think of a rope that you would tie a boat up with, and when you make it taut and you pull it at the end, there's a nice snap and a nice firmness to it. And then take a rubber band and pull it and pull that. And there's an extensibility to the end of it. That's how all of their joints and ligaments, when their ligaments should feel like that rope, they are actually like the rubber band. And
Which
so
you don't want to tie your boat to with a rubber band.
No, right? I mean, then it's like, pistoning all over the place. And then what happens is you get little micro cracks in the side of your boat, and you get, like the deck starts to sway. And that's exactly what happens. So now their muscles are working overtime. And so it's like you're walking around holding a 50-pound weight in a bicep curl all day. Eventually, your muscle is going to just be exhausted and start to get cramps and start to get those trigger points, and it's going to feel tight. But it's actually not tight. Their muscles are just working too hard. So as they come into somebody that doesn't know how to evaluate true muscle length and joint accessory motion, you can actually do more harm than good.
Now, let's get back to like the basics. Who would be able to? Your general care practitioner is not going to be able to do that.
Yeah, so that's where physical therapy is trained in accessory joint plate testing, muscle length testing.
But to get to physical therapy, you need to go usually to the doctor, right? To be
potentially, yeah. But I mean, in Michigan, there's direct access, so you can walk in.
And that's the point of having this conversation. Is like, at once upon a time, or even just whatever the stigmatism we have around it is, we just think, well, no one recommended it.
Yeah.
Today, what we're saying is, okay, if
you
feel like
this,
something's off, or you need a second opinion, or just for everybody to have a look.
Yeah, call. Call in.
A
and
look
take
under
a look.
the hood and your musculoskeletal. So,
and we would treat those people totally different than somebody that was truly tight.
Yeah.
Because I'm going to work that tissue and work out that tissue. We may do needling, we may do a little cupping in through there, but in the mid-range. If somebody truly comes in and is tight and they have crepitus and their muscle length is shortened, and we're going to stretch. I'm going to get in there and stretch that tissue. But you can't treat them both the same, because you'll have one completely destabilized and bedridden and the other one not treated.
So how many people have EDS, or is there kind of a middle area?
Yeah, EDS isn't super common, but there's more people than you realize because it's very much not diagnosed. And so there's a spectrum.
Would this be people that have always been hypermobile, or is it?
Typically, yeah. With individuals that have a spectrum of hypermobility or too much mobility, they usually do really well in dance, gymnastics.
That's what I was going to say. Are these gymnasts that come to see you at 25, 30, 35?
Yeah. And so these individuals, as long as they're strong, their muscles are very strong, they're going to be okay. It's when they stop competing in their sport is when things start to unravel. And it can unravel very quickly and very violently for individuals.
Is EDS, well, not EDS, but is that hypermobility ever a great thing? Or are you?
Yeah, I mean, I think when you look at hypermobility, there's a spectrum. Hypomobility was like you're really stiff and rigid and you don't move, and your joints aren't moving even through their normal range.
Yeah.
Then you have kind of normal mobility, and then you have hypermobility. And so in some instances, like you're not going to see these gymnasts performing without some sort of hypermobility. Their joints are moving more than the normal range of what a joint should do on a regular basis. But you also look at them and they are solid muscle. And so they are protective.
It supports form follows function. Well, Reynolds always would say that. And so you're never going to see necessarily no muscle gymnasts with that mobility.
Right. Being effective. You're not going to see them in the Olympics. They're not effective. They're hurt and they're not making it to that level. Same thing with Olympic swimmers. Their shoulders are hypermobile. You can't be an Olympic swimmer without the excessive motion that you need to develop the leverage to be best in class in the world.
I was thinking about like the Olympics with hockey and the goalies, I don't think any goalie at that level can't do the splits.
Right. Yeah. No, absolutely not. They are extremely flexible, very agile.
Internal rotation of their hips, which is my weakness.
That's where they live.
I can't even. Nope. I quit. Let's talk about pain real quick. I think you did a nice job explaining when some people feel more pain or less pain, and like what's normal pain and what's not normal pain, and what's really happening in the brain for that.
Yeah, and it's interesting because pain is very subjective. And one of the things that we look a lot into and what's drilled into a lot of healthcare professionals is this pain exertion scale. So I'm sure you've seen it. It's been on the walls probably in any medical facility you walk in where there's like this really horrible sad face and there's a 0 above it, and then there's a happy face and there's a 0 above it and there's a 10, and it's like they look absolutely miserable, and it's like, where's your pain on this spectrum?
Right.
And it's very subjective on how people process pain. And we know that how people process pain, whether, it's logically or emotionally, and it also how you process pain is how full your bucket is, your overall bucket, your stress levels, your overall health, all of that,
Optimism.
Your motivation.
Yeah.
How
much hope you have, right?
Yeah. Yep. Hope and optimism and, all of that is directly related to pain. And so, when I'm working with patients, I try to break it down in regards to tissue healing to make it a little bit more objective and tell them, there's tissues heal at different time frames. And so when people become informed, they have more empowerment. And when you have more empowerment, you have less pain because you can see the future potentially, as opposed to being fearful of, I hurt and I don't know why, and I don't know when it's going to go away, and I don't know how to fix it.
And that sounds like a safety mechanism for us to kind of just go into a shell if we don't know.
Yeah.
It hurts.
Right. Yeah. And so the more you know about what's causing it, the more empowered you are, the less full your bucket is, and the more buffer you have to be able to process your pain.
And you were talking about that processing, and it's very emotional. Like the actual science about it is very emotional. And like when is pain not normal? Like when does that happen? Yeah.
So pain is like we had talked about before, of when you normally should be processing pain in the prefrontal cortex, the logical part of your brain. If you've had pain for a really long time, it switches to your limbic lobe, which is the more emotional firing there.
Yeah.
And so when pain is not normal is when you're having pain in a tissue or in an area or in a region that is fully healed. And based on the time frame of tissue healing and inflammatory phases.
Science of pain.
Yeah, it's called neuropain science education. And so when you have a tissue that is completely healed and is moving normal, but your body is still generating pain from that, and it's real. Like, it's not like you're imagining it, and sometimes people come in and they said, well, they're telling me it's all in my head. Well, yeah, it is all in your head, but it's real. So is the fact that you just walked in here. That's how you moved your muscles. That was all in your head too, so it is real, and it's real to them. But when you're looking at how you can start to change the processing, it's by educating, saying, okay, your skin is going to heal in 2 weeks. And then you're going to look into your muscles are going to heal a little bit quicker. Then you're going to go, and then the next level is going to be tendons, and then ligaments, and then cartilage. So you look at the spectrum and time frame, and when you're looking at 12 to 14 weeks, you're looking at tissue turnover recovery that tissue should be healing. So either you're not developing appropriate load through the tissue that it's healing appropriately, so you're continuing to re-injure it, or you have a pathology in healing, so you don't have the nutrition support to heal, the building blocks underneath to heal, or you have a pain processing problem. And oftentimes I'll have people that come into me and have seen many, many other providers, and in fact it was a pain processing problem. And we address that.
And are you responsible for that? Can you help them with that?
Absolutely. And that can be changed and turned around relatively quickly.
Could your clinics spend all their time on pain if that's what you targeted? I mean, it seems like people are in more pain than ever before. Obviously, You're talking about the opioid crisis and different pharmaceutical, addiction of all that kind of stuff. But pain's kind of right there. It was, what did they say, the sixth vital sign is, and like you said, it's that smiley face or that unhappy face.
Yeah. And that's the thing. It's like there is a lot of discomfort, and understanding and educating on the difference between like pain and injury, because they're two different things. And sometimes they come along with each other and sometimes they don't. That's where somebody can be injured. I can see an MRI that just is atrocious. And that person walks in and is like, yeah, I got an ankle pain. And I'm looking at their back MRI going, I don't know how you even walked in here. Never complained once about their back. And then I have another individual that can come in and their MRI is clean.
So pain and injury aren't always connected.
Right. Yeah. And so that's where when you start to look at being able to be, I would say evaluate clinically what's going on with what you're seeing with tests and measures. You can't use one in silo without the other, because you have to be able to provoke and alleviate symptoms, and it has to be able to match oftentimes with imaging, which often we don't even necessarily need imaging at times to evaluate these individuals, but they don't always go hand in hand.
Well, I mean, if you're listening, you can kind of see why I'm having Jill come back in, because I think there's just so much information that our body can give a trained professional. And sometimes we have blind spots, or many times we have blind spots, and sometimes our focus might be over here, maybe on pain that we're processing, a pain processing issue, and yet we think it's an injury. We think that we went to the mailbox and tweaked our back, but there could be a disconnect there. And a lot of it when I'm thinking is there's acute injury, right? And you deal a lot with that. But a lot of what you're dealing with is that chronic pain and maybe chronic injury that didn't just happen overnight. It's sitting, it's poor posture, it's hormonally and all those things, which leads kind of this connection that I know we've really been trying to work together on, is this connection between the gut, inflammation, and how the body heals and recovers. And you kind of just said, do you have the foundation for those tissues to heal? So talk about your perspective on the connection between gut, inflammation, and how the body recovers. Because now we're talking brain and body. Which for a long time, we didn't want to admit we're connected. Right,
yeah. Well, and there's an interesting study that came out of Harvard that when you talk about brain and body, it was done on housekeepers in a hotel. And they had a group of them that they sat down and they told them that their job hit, all of the requirements that they needed to be healthy, because they're active and they're moving and they're lifting and they're, and at the beginning of it, they took all of their blood work done and they did muscle biopsies.
Okay.
And the other group they brought in and they had a conversation in regards to them about, how their job, their day-to-day job and that it's basically the things went through the tasks and that kind of stuff, but didn't talk anything about how it increases their health and increases their wellness. And they did this for 8 weeks. Then they just let them go back and just do their jobs. The only difference was, one, they just talked about the tasks that they were doing on their jobs. The other one, they talked about how what they're doing hits all of like the AMA requirements for overall optimal healthiness and wellness and, with exercise. They came back at the end of that and took their muscle biopsies and blood work, and the group that they educated had increased muscle hypertrophy, had better blood work results, and overall showed and said that their overall wellness and happiness and healthiness had improved significantly. Nothing had changed in what they did except for they are educated. So when you talk about mind-body connection, is it, there's so much when we get in the professional sports world, when you talk about visualization, and you talk about the mind.
It's as powerful as really doing it.
Right. Yeah. They're thinking that their job is training. They actually had the physiological response that they were. And it showed through biopsies, through blood work, it's the craziest study. It's really interesting.
It's crazy. And we have a mentor, and he asked me a question, is when you think about yourself, anyone, what has not changed? And he said it's consciousness. And so the thing that gets kind of weird for people and kind of out in space is we do understand the brain and we do understand the body, and now we're connecting the dots. And then you have this thing called consciousness, which no one's ever been able to point out where is it. Yet we all know that it's real.
Yeah.
And so I do think there's this magical thing that's happening that scientifically and all your research and my research, but on top of all of that, there is a power that sometimes we can't realize that can connect it all.
Yeah.
So like when you think about the housekeepers and, how they're thinking about it and their perspective and optimism and hope, like that is a huge healing part of therapy. And I think we're trying to do it in medicine. But again, it's like what we can't measure, we don't manage and we don't treat and we don't prescribe, but it is powerful. So mind body is definitely connected. When it comes to like gut and inflammation, how can you help your patients? Like, I'm thinking in my head, like when I go to see Josh, who's in your Mason location, I wish I had like 3 hours.
Right.
Him,
Right.
He doesn't have 3 hours to give me.
Yeah.
I mean, he could. I'd pay for those 3 hours. But on top of that, now with everything that that nutrition and sleep and certain supplementations can assist with this process of healing or recovering or optimizing.
Yeah.
But where does it fit, and where are you thinking about this in your practice?
Yeah, when I think of like the mind body, mind gut connection, it's a really big deal when it comes to inflammation. And I think more so than what we realize, because of our diets and what we're eating and what we're putting in our bodies, we're on a uptrend
Crash
of
course.
inflammatory conditions, and so when we start to see joint inflammation, when we start to see muscle inflammation, when we start to see organ and gut inflammation, ulcers, and anxiety, which is driven that mind-gut connection, where you're seeing those kind of things. And some of it is that we need to move more, because movement increases all of that, decreases anxiety. If you go back to the age-old day of like, we're fighting for our lives from the tiger that's trying to, get us.
Yeah.
So move, right?
Yeah,
like
just
that
sit
moves.
in the cave.
Yeah, because we're sitting there scared to death of the tiger, but not moving.
And now we're in
we're
in a physical environment where we're sitting at a desk.
Right. Yeah.
Yet we're still trying to cope with it. Yep.
Yeah. Yep. So I think the movement is a key component of that, of the mental health and well-being. But then diet and nutrition in regards to your omega-3s and your omega-6 and your building blocks, your amino acids, and the main substances that you're putting in your body. If you don't have, like, I think of physical therapy as those building blocks to build you back up, but you have to come with the tools. And if you don't have the tools to put it together, you can stack it all up, but then when you walk out, it's going to tumble.
The material, you need the material, right? The cement, and the rebar, and and that's all those nutritional things. But how do you have enough time in your practice to do all that? That's the challenge, isn't it?
Yeah, and and that's
you're trying
the thing.
to evolve and get better, and
always, right? And so curiosity in healthcare needs to improve. Because what you get when you graduate and, when you have your
Are you talking about the
licensing.
individual practitioner, or are you just talking the big...
all around, I think. Like, just because you have your license to practice medicine or practice physical therapy, like that's the bare minimum requirements. Right. I mean, I used to write the test for the the examination or the questions, and it's the bare minimum to practice. From that point, you have to be curious, because when you say, when do you have the time? If you have a patient that comes in that's not healing, you need to be asking yourself why. And you need to be finding those answers. And so through those answers comes those aha moments and that, oh yeah, and the, oh my gosh, and I reached out to this person and that was the answer. And maybe I can help others from that. And oftentimes that collaboration, and that's one of our core values within our company is collaboration, but oftentimes everybody gets so busy and bogged down with all the things, the logistics and the paperworks and the, litigation, prevention, medicine, that it takes away from the ability to be curious. But you have to find the time to be curious, because that's where the innovation and the growth happens.
You teach a lot. Can you teach curiosity? Or you try to create systems and processes that kind of nurture it? Like what do you see?
Yeah, so I think what we do at onboarding is...
Do you hire for curiosity?
Some of it is you need to hire for curiosity because and naturally people are more curious than others, and they need to have the capacity to be curious, and so, but you definitely can start laying a foundation of multiple questions and, multiple topics for them to dabble so that they can start to, I want to know more. Mm-hmm. I want to know more. Yeah.
Yeah. I mean, one of my favorite books is about the growth mindset and, a fixed mindset. You could be the smartest, probably in physical therapy. You could have all the certifications and knowledge and do well in the test. But once you lose that curiosity and become that fixed mindset versus the growth mindset, I think it puts us in this kind of narrowed focus that might have some specialty work, but misses that huge opportunity for that holistic view. And you want to have kind of a little bit of the art and science to do that, where you kind of have to sometimes zoom out. They want you to improve their spine at L4 and L5. Yeah. Yet you're looking over here and you see some huge opportunity because you're looking at the whole body. Yeah. And it's tough. There is only so much time in the day too. Right. Yeah. And the one thing I think about rehabilitation providers is that we do have a little bit more time with our patients than most, other healthcare practitioners. So if, that average is 7 minutes with them. You're building kind of a relationship. Right. We're there for an hour. You start to get something, like I'll have patients that come in. And it's an hour that come each week or a couple of times a week. Right, yeah. Right? And I'll have patients that come in, I didn't tell my doctor this, but, I did get hit by a car. And I'm like, whoa, like, that's a big deal. Yeah. Like, what do you mean you got hit by a car? Missed
like,
that
well, that was a couple years ago. And I'm like, but.
There wasn't a place to write it on my intake evaluation.
Right, yeah.
That's, it's like you've seen the memes or the things where a personal trainer, a physical therapist becomes somewhat of a therapist mentally too, because you're expressing and you're got a relationship. And I think there's an art in any type of therapy or coaching, where you're getting to know that person, which opens up. Not only can you nudge them to a better behavior, but also get more data on what some opportunities. Right. Like nobody can read anyone's mind from the first time they come. Yeah. You can look at the body and you can see but you don't have the full. You keep trying to gather that through curiosity. I think you guys do a great job of that, because the experience is not just get in and get out. It's like, what are we trying to accomplish? Not only what you want to, we see some areas of opportunity, and do those connect? I can't imagine how some people come in and they're saying, I want this, and you're looking at them, like you said, with that MRI, and their back is a mess. Right, yeah. They're trying to fix the ankle. Right, yeah. But at some point, you got to make sure that they're on the same path. Yeah. And I think that, it's interesting. Once you get skilled enough with your hands, and this is, why you want to make sure that your healthcare team is highly qualified, because if you're working with somebody that's skilled enough with their hands, they can pick up on those things without you having to tell them. And I'll give you an example. Is I had an individual that I've been working with him for a while, and we just hadn't been able to get over the hump. And he was an individual that
he was a big drinker and he loved his wine and but his body didn't love his wine. And so, I think I might have been the first person that ever had the conversation with him is like, do you understand that, a little bit is good, but any of it is toxic that you're putting in your body. We got him to the point that he completely quit drinking. Mm-hmm. And about 3 months in, I was like, man, his tissues felt amazing. And his tissues started feeling boggy again and started feeling, and just in conversations, I was like, hey, like, I'm just going to bring this up. Like, by chance, have you started drinking again? Because your tissues feel like they used to feel,
sure.
And he's like, no, actually, I haven't. He's like, but I started this new medication that this doctor put me on, and I haven't felt the same since then, and I forgot to tell you. And I was like, well, I don't think it feels like it's good for your body because now your joints are feeling swollen, your tissues are feeling swollen. And he's like, I've been feeling that, but I just thought I needed to keep taking it.
That's pretty powerful. I mean, again, it's another case for just having that expertise, having that knowledge with your hands. And I know enough about the body, but like having someone else's knowledge in areas that you can't feel because you get used to it. And I think
you don't know anything different than yourself, right?
That's
like
all you know.
Yeah.
That's all you know.
Yep.
All right, couple more things as we get you out of here on part 2 is there anything that athletes do, like when we think about peak athletes, that we should be trying to do? Is it a mindset? Is there anything that you've seen working with the top athletes that the average person could benefit from, other than move your body on a daily basis, because that's what they're doing? But is there anything else mindset-wise or schedule-wise that you see?
Yeah, when I look at, and this is something that has drastically changed over the years, and, everybody wants the $1 million question, where's the pill? What's the thing? And I could tell you if the one thing that we've changed, they're seen the most drastically in the years in regards to professional athletes and directly related to performance is sleep. And when you see individuals that are performing at their absolute highest level, they are on a regimen and sleep schedule. Because that's when recovery happens. Like that's when you're getting all the remodeling that's happening. That's when you're getting the reprocessing of your brain. That's where coordination starts to happen when you start to get into that deep sleep. And so it used to be kind of cool where it was like, oh, I only got a couple hours of sleep. I pulled an all-nighter. Like if you're looking at the top level performance, that's not cool anymore. It's like, oh man, like that, like that's bad news. Like you need to get to bed. You need to be to bed at 9 o'clock and you need to get those 9 hours of sleep, and that's really starting to become a focus on recovery as opposed to more and more and more. Because what we found at that high level is, the top 1%, like an iota of difference. Like if you're looking at a professional athlete, if they've noticed 1% different, they're testing for sports enhancing drugs.
Yeah.
Like that's how close they all are, right?
It is a performance enhancing. Yeah.
So when you're looking at sleep, that's one of the biggest things that you can do to enhance clarity, performance, overall, delivery, muscle tone, hormone balance.
Yeah, and it's funny because I think I just actually watched a video on sleep and beauty. So like your appearance, your skin, your collagen, your elasticity, your repair of the skin cells and hair and regrowth and even the mitochondria and gray hair and all that kind of stuff that we're, I think, in this crazy fight against. Yeah. Yet we're sleeping 6.5 hours on average. Right. The average person. Yes. Now, I think athletes understand it, and you're maybe listening, well, I'm not an athlete, but this is an area that it's not anything that you can come in and do for them. Right. Yeah. But yet we all have the opportunity every night to tap into this performance enhancing, and if you're not playing a sport, like life enhancing drug. Yeah. And the one thing that I would say is that, I don't know if there's research on it. I haven't done a ton of research on this, but just from my clinical, kind of what I've seen is that your sleep patterns for the rest of your life are developed at a young age. And
solidified, I feel like, from what I see with my patients, somewhere between, like, as your prefrontal cortex is solidifying and finally developed. So, right around your, like, 18 to 25,
Sure.
26, right around there. And so the best thing, if there's parents listening, that we can do is to get our kids on these really good sleep schedules so that they are starting to solidify going through the phases of sleep from, falling asleep to REM sleep to deep sleep. They're getting through that cycle because you need to get through it 3 to 5 times a night to get that turnover.
Yeah, it's same with nutrition. They don't always have to be perfect.
No,
But they have to be exposed. The values have to be there.
Yeah.
The opportunity has to be there, because how you eat when you're 18 doesn't necessarily mean how you're going to eat the rest of your life. But
Right.
are you thinking about it or exposed to it? Because if you
Or do you have a role model that you've seen?
Because you hear people that say that I'm a picky eater.
Yeah.
What does that mean?
Right.
It means you for whatever reason neglected or avoided or weren't exposed to these foods because of
one reason or another.
one reason or another, and
Yeah.
and our taste buds change every 6 or so years. But I do think that's a powerful statement, is like what you're doing in your 20s. And I show this graph of like health span, healthy life. You don't lung function, mobility, flexibility, hair, skin, and nails don't really change all that much. It does, but when you really have an unhealthy lifestyle, the cliff comes. But what we do in our 20s, 30s, and 40s, we think, well, I could do anything then.
Yeah.
But it's building this thing for the future. And that's the same with your sleep habits. Like how you're sleeping in your 30s, whether you're sleeping 6 or 10 hours, you may feel like you're performing the same.
Yeah.
But what's that leading to when you're 50? It's it's like the investment that can't get any more valuable.
Yeah.
And it gets harder and more valuable as you age.
And your body's really resilient. And so oftentimes what I hear all the time is people come in and they say, I'm like, well, tell me a little bit about how you're moving and how, and it's like, oh, well, that's normal. I've done that my whole life. And it's like, well, that's fabulous. That's great. But that's why we're here. We talk about this all the time. You don't die the first cigarette you smoke.
Right.
But it's not a healthy thing for your body. And over time, there will be effects. And it's like you said, when is that cliff? You're getting closer to the cliff. And so if we can mitigate that before you're to the cliff, that's the goal.
Triggered in my brain. Can you feel nicotine? You could feel alcohol in that example. Can you feel nicotine, alcohol, different drugs in a body? Like, is it that nuance or not really?
No, I can't feel that in the body.
Like something's happening.
But I can feel how the tissues feel. And I knew I had seen that person long enough that I knew that alcohol, when there was alcohol in the system, that his tissues felt like that. And I can't, it's not like this higher power or anything like that. But definitely, I can tell that I can feel inflammation. Physical therapists can feel inflammation in your tissue. They can feel the bogginess, different tissue texture abnormalities, those kind of things. And
is there conversations in the physical therapy world around someone's coming to see you for therapy, but they're smoking cigarettes or having nicotine in their system, about the inflammatory impact? Is that out of bounds, or is that part of the conversation?
I think it 100% needs to be part of the conversation. And for some reason, somewhere in healthcare, it's kind of been like there's apprehension to have the conversation.
To help them with what they're coming through.
You have to care enough to have the confront, to have the conversation.
They can
do
you.
And they can do whatever
else.
They want with it, But giving somebody education and knowledge to act on something is caring enough to be able to give the information. Not because you're going to be accusatory or whatever. But you can continue to do this. These are the effects. If you smoke an hour after you're in physical therapy, it takes away the oxygenation and the overall turnover of the muscle. So it's going to take away about 90% of the basically what we did to make the muscle bigger, to make it stronger, and to make the joint heal. So it's going to take you that much longer when you're doing this without oxygen.
And that's, again, my oldest is 9 years old, and I'm trying to teach him without preaching at him, but doing the hard stuff first makes it easier later.
Right.
Versus doing the easy thing. And I think in healthcare, we have gone to this model of we don't want to offend. Is it our place to talk about behavior? Mm-hmm. Yet
Yeah.
we're spending way too much money without the outcomes and
Right.
overall.
Right. Yeah.
Because I think sometimes we sugarcoat like the importance of diet and nutrition and exercise, and then on top of that, some other habits like poor sleep or too much alcohol use or
Yeah.
nicotine or tobacco or whatever the
Yeah.
vice is. And I think that back to that curiosity that you have and you teach, but it's more about the care too. I want you to get better.
Right. Yeah.
You know, sometimes do you care more than they care? Does that happen sometimes? I feel like sometimes people come to see us because they just want to check the box, and we tell them, I think I care more about your health than you care about your health.
Right.
Not
yeah.
that anyone doesn't want their health, but they're not ready.
Yeah. And the gradient. So I always look at the gradient. Like if I feel like somebody doesn't care, I don't know if that's necessarily true.
It's not the right
it's
word.
that
Maybe.
the gradient's too steep for them to see that what they're doing, that there will be outcomes, or the outcomes aren't going to be quick. Yeah, and it's like I just don't have that capacity. So how do you take that elephant and break it down into bite-sized pieces? To how do you eat an elephant? And so I look at that as like when I'm getting that or I'm getting that pushback. Oftentimes it's because the gradient, for me seems easy.
Yeah.
But for maybe this individual, it's like there's just no way. It's way too much. So you break it back down, simplify it,
They're trying
and
to
then
climb
you
that
start
hill
to
with
see
bricks
the
in their
momentum.
book bag.
Right?
You don't have
yeah.
any bricks in your book bag. Yeah. Last question: how we started, and I think we could spend so much time on this. I'm trying to navigate it, but the healthcare model that we currently have, and let's just paint the picture. We maybe have a general practice physician or someone that we go to see for a physical, and then we have health insurance. And that's kind of I would think the simple model, and we understand we have emergencies or different accidents. But what's the ideal healthcare model in your mind look like, where we can start to require and expect our healthcare professionals to optimize and pick the right strategies for our health versus just whatever fits into the bucket? Like, I go to this person because my insurance covers it, or I don't go to see Jill because I didn't get a prescription and I don't know where to start. Like that excuse that we've, I don't think we've intentionally done it, but that's where we kind of have landed. But what's the ideal model for you to create this performance that I think you're really after?
Yeah, as you're saying that, I'm thinking of like, oh man, in an ideal world, any way that healthcare providers would be reimbursed would be based on outcomes and not injury. And, right now, if you look at our systems, reimbursement is based on illness, not prevention, and it's hard to get prevention. And I also think that
Is that because they think that someone's going to take advantage of it?
I don't know. I think that's just the way it's always been. And I think it's gone off the rails a little bit, and I think we need to start looking at it differently because it's not working. We're not getting healthier by the system. And what you pay for gets reinforced. And we need to put the money back in the hands of the consumers, not the insurance companies. Because when people have ownership and understanding of the value and the amount of money that's being spent on whatever they're getting and whatever they're receiving, they will expect different outcomes and different results.
Yeah.
And right now, healthcares, and we were talking before this, like intermediary healthcares or TPNs, and where there's your health insurance plan, but then they're paying another carrier that actually collects the money, and then there's another carrier involved in regards to authorizations. And so there's so much confusion. The consumer doesn't know. It's not a direct correlation. Like if I'm going to go and buy a widget, if I'm going to go and buy a car, I know I'm going to spend $30,000 on a car, and I'm going to get the best car that I can for $30,000.
Right.
And if the consumer had $200 in their hand, they would expect that as well from their healthcare providers. But when that's removed, you stop seeing or putting value with your care and your quality. And that's what's wrong with our system right now.
And so what triggered this conversation on this topic, and before we hit record, is I'm switching in insurance, and I'm out there in the marketplace trying to find it for our family. And, it ranges from, it will probably be between $2,000 and $3,000 a month for our family to have coverage. That's
a lot of money.
$20,000 to $40,000 of money. And so then at the end of the day, when you see that money, it's not your workplace providing it. You don't even know how much you're paying.
You have a certain amount that comes out of your check that you never see because it never ends in your account. You don't ever see the value. And then you go and
get the procedure or the appointment, and you don't even know how much it costs, but insurance covered it. And when you transact $200, $300, $500 for things, you start thinking about outcomes differently. And I already do think about outcomes because I look at massage and physical therapy and personal training. I look at this as my toolbox, these partners.
Yeah.
And some people might say a massage for $200 is outrageous. I was in Washington, D.C. I got the best massage I've ever got for $200. The environment, the questions, the curiosity she had, the work she did, deep relaxation, combination, knew the body, wasn't just banging on, putting me to sleep.
Yeah.
So she had the skill set for $200.
Right.
Yet we go and we get a routine physical where they don't take my shirt off or my shoes that may cost me several $100s.
Right, yeah.
But I never saw it. I never saw it.
If you don't see it, you don't know, right?
So in your perfect world, you're going to have that transparency where you know what an appointment costs or colonoscopy or a knee operation or that surgery that
the consumer takes back the power of their health care, and there's not an intermediary in between that causes confusion.
For both, even the provider and the consumer.
Yeah, because if you, like your insurance, you go and say the bill's $500, your insurance covers $450 and you pay $50. You're thinking the value of what you got is $50 because that's the transactional amount.
Because you never saw it.
Because you never saw the difference. But it's costing everybody else that's paying into it a tremendous amount. And we need the consumer to drive results, and that will make everybody better. Because when you expect results, people will start to deliver to that because that's, economics 101.
Yeah.
Right? And so, I think that's something that in healthcare we need to look at that a little bit better, and how do we get the understanding and the healthcare literacy back in the consumer's hands?
Yeah. Well, I think you're doing a big part of it, and that's why I wanted to have you on, and we'll continue to have you on because I think it's a wealth of knowledge, and it's a wealth of knowledge that not only in mid-Michigan area with your 5 locations, but like if you're listening in California, there's, I'm guessing, a pretty good physical therapy professional that can help you and evaluate you and give you some of that expertise. My takeaway for today was many, but I think this was the most profound. I wrote it down, was injury prevention equals peak performance. And you didn't say it necessarily that way, but we think about physical therapy as going when we're injured or we had an accident and we're trying to get us back to where we were. But you also look at it from peak performance as how do we prevent or optimize the body so it's not injured so that you can perform at your best. And that's how we cross paths is I didn't have an injury. My legs kind of felt not as optimized.
Yeah.
And again, you're helping me and Josh and the work that I'm doing on my own to help me get to my peak performance. And I have a pain on the scale as mine's a smiley face. I have zero pain.
Right. Yeah. Yep.
Yet when I go to run, it doesn't feel like I'm where I want to be because of some things. So I think that injury prevention thought about equals peak performance is that's why you want to go work with a physical therapist because they may expose you to something and that curiosity that you have no idea.
Yeah. Yeah.
And that's fun.
Yeah. And I say to patients all the time that just because it's common doesn't make it normal.
Yeah.
And so as you're talking to your friends, oh yeah, we all hurt. That doesn't mean it's normal. Yeah. Just because it's common doesn't mean it's normal. So just be careful you don't get caught up in the common aches and pains when it actually can be prevented.
Love it. And we'll see you again next time.
All right. Thanks.